PRAISE stands for Positive Reporting and Appreciative Inquiry in Sepsis. What we wanted to do with the PRAISE project was test whether the Learning from Excellence initiative could be used as an intervention in the quality improvement setting. We want to achieve two aims. The first is to recognise what's working and try and learn from that, what's working in our system, but also to provide a system for providing positive feedback for staff who are achieving excellence. The problem we were trying to address was antibiotic stewardship, but also early treatment of new cases of sepsis. Improvements in both those areas rely on changes in physicians' behaviours. We took a different approach to quality improvement. The traditional or prevailing approach to safety and quality improvement is to recognise what's going wrong and create system changes in order to mitigate that. The Learning from Excellence philosophy is a complementary but different approach, that we recognise what's working, what's going excellently, capture that and then amplify it. So what we aim to do was to improve treatment of early sepsis but also antibiotic stewardship, and the single aim that we came up with using the IHI model for improvement was an overall reduction in antibiotic consumption by 5% in PICU during the study period.
The driver diagram helped us to remain focused on the process measures that we generated, which were a main focus on documentation, the quality of prescribing and stewardship of antibiotics, so de-escalation. We predominantly were looking at the quality of prescribing, which we defined as entirely legible with a clear indication and review date. And when we encountered charts that were gold standard or excellent, we generated a positive report. Excellence reporting is a trust-wide system that enables staff to positively feed back to their colleagues if they see something at work that they feel is excellent or good practice. Appreciative inquiry is a grounded theory research methodology that focuses on what is good in a given situation. We designed a protocol that we've called the mini AI, and it can be done at the bedside clinically in about 10 to 15 minutes.
So our main intervention in this project was to provide positive reinforcement using excellence reporting and appreciative inquiry in recognition of excellent behaviour around the use of antibiotics in paediatric intensive care.
So our primary aim was to reduce antibiotic consumption by 5%, and in fact we reduced it by 6.5%, so we certainly did have a positive impact. And we had quite remarkable change in broad spectrum antibiotic consumption, which reduced by 31%.
The impact of the interventions on behaviours was interesting. Our main intervention focus was on documentation behaviours, and we found that some documentation improved significantly more than other documentation. For example, we focused a lot of positive reinforcement on prescribing behaviours, and these dramatically improved throughout the study. Prescribing behaviour is a daily activity, and there are a relatively small number of prescribers, about 40 or 50, compared with an overall staff number of greater than 300. So we think this area was impacted on well because the density of our intervention was quite high in this group.
So it was very interesting speaking to the staff on the unit and about what motivates them to perform well or to do well, or what are the conditions that allow them to do well. And there certainly were some ideas, some practical ideas that were implemented on the unit. The interviews are an intervention in themselves, and I think they create a space for the staff to reflect on what they've done well and why it went well.
From the outset, this was a proof of concept test as a unilateral approach to quality improvement by only looking at what was working, what was going well. And what we found is that this approach did impact on several process measures, and it did in fact achieve an overall positive aim. So I think we can say that this positive approach can be used as a quality improvement intervention. We also learned that it doesn't work on every type of behaviour or every type of process, and it may be that there's a saturation effect or a density effect on reporting, and that I think requires further study. I think the main take-home point from this project is that if you show people what they're doing well, they'll do more of it.
Because most times I'm working, I don't even remember that the PRAISE team are going to come through, they're going to review my notes. Did I prescribe the antibiotics on time? Have I given it correctly? But then when I get that, I'm like, I'm doing it well. And it pushes you to continue to keep focus, make sure you're checking everything, because somebody else is looking after you. So it's good.